Welcome, and thank you for tuning into Derm Docs, powered by LiveDerm. This special episode marks the kickoff of a new mini-series, Psoriasis and Skin of Color Unplugged, supported by an educational grant from Janssen Scientific Affairs. These next 4 episodes will feature expert dermatologist Dr. Mona Shahriari and her various guests as they discuss the gaps and needs in the management of plaque psoriasis in patients with skin of color. Thank you again for joining us for our first episode, Disparities and Access to Care, featuring Dr. Candrice Heath.
Hello and welcome to our podcast. My name is Mona Shahriari. I'm an assistant clinical professor of dermatology at Yale University and the associate director of clinical trials at CCD Research. And today I am joined by my esteemed colleague and friend, Dr. Candrice Heath.
Thank you so much for having me. Yes, I am Dr. Candrice Heath. I'm an adjunct clinical assistant professor at Temple University in the Center for Urban Bioethics and an incoming faculty member at the Howard University Department of Dermatology in Washington, D.C.
Thank you so much for joining me today on this podcast. So we're going to be talking a little bit about the socioeconomic barriers, access to care that our patients with plaque psoriasis who have skin of color face. I know you and I have had a lot of conversations about this offline, and it's a topic that we're both very passionate about. But just to kind of start things off, how do you define skin of color in your practice?
Yeah, I think that's a great question. So when I think about skin of color, I first think about those who have more melanin in their skin. We all know that we all have some, unless you have a genetic defect, where you can't, make melanin at all, we all have a certain amount of melanin in our skin. And when I think about patients with skin of color, I think about those who have more melanin or those with darker skin tones. In the past, we think about skin of colors, being occupied by a lot of people of different ethnicities. But we know that, people with skin of color can really have a wide range. So I think the thing that biologically is the definitive marker is, having an increased amount of melanin in your skin that really makes it more likely for your skin to react in certain ways. Does that extra pigment make you at more risk for having hyperpigmentation or forming thickened scars, things like that? So those are kind of the things I think about when someone asks me, what is skin of color anyway?
And I couldn't agree with you more. And to broaden that definition, like you said, a lot of patients that identify themselves as non-white, even if they are a little bit fairer by virtue of kind of what region of the world they come from, that can have some impacts on their response to therapy and some of their post-inflammatory changes or scarring potentially. So I think it's really important to make sure that we're treating all of our patients with that inclusive look, really listening to the person in front of us and really checking the biases we have at the door and listening to the individual sitting in front of us. Because a lot of times I feel like we may think someone is a certain skin of color, identifies with a certain culture or race, and I walk in there, start talking to them, and it's so complex, the background they come from, and I don't know what elements they actually can relate to and what they identify with.
Yes, I think it's a complex topic, and I love that we are speaking about it more and more, even in the context of research. So it's a very important topic, but really to simplify things for our listeners, having extra melanin in the skin. That's what we're talking about when we think about patients who have skin of color.
Certainly. And, as the population in the United States continues to diversify, I know a lot of these patients who are now considered minorities are going to be making up the majority of our patients in our clinical practice. So what can you tell me about some of the barriers to care, especially in plaque psoriasis, that these patients face so that we can be prepared for them down the road when they're the majority of our patients?
Yes, and I think that's an important point because you're right. As we continue to go on, the populations of people with skin of color in the U.S. and across the world are just going to continue to grow. And as someone who takes care of both kids and adults, I'd love to add that, the pediatric population here in the U.S., we have surpassed that, 50% number. So the majority of kids, here in the U.S. have skin of color. So if you are not seeing it in your practice, you will be soon. So it's an important time to really zoom in and think about some of those common conditions like psoriasis. How can that look different, and how does it, impact our patients? So one of the things that's important to think about when we think about our patients of color here in the U.S., not all of them are economically disadvantaged. But when you look at statistics, the majority of patients with skin of color may be facing some barriers. Economic barriers like, not even being able to take off from work, for an example, to even come to a doctor's appointment. That's an example of, someone who is facing some economic burdens that, they may have to have a specific type of job. They may have to have a specific type of job or career that doesn't allow them to even take off. And then what about even travel to get to actually see a dermatologist? All of these things that we really don't talk about enough can affect our patients, even in the dermatology setting. And then, something else that I think should be added to the list is we'll talk more about this, is that it's just even under-recognized that psoriasis can happen in people who have darker skin tones and more tightly coiled hair. So just in amongst, physicians and amongst healthcare, but even amongst, the population, itself may not even know that this is a condition that exists and that can affect them as well.
And what do you think about the habits of some of our patients with skin of color in terms of seeking out care, receiving care? I know a lot of times in my practice, the patients have waited and waited for so long before they saw a practitioner, even a dermatologist. Or when I start therapy, sometimes they disappear and they're lost to follow-up. What do you think's happening there?
Yeah, that's when social determinants of health really, come in, because people are facing barriers that sometimes we may not know about. So yes, it may be obvious. Some barriers may be obvious, but others may not be. People may not wear a label that says, "Hey, I have a issue with transportation," or "I'm not able to take off from work," or they didn't realize that there were refills at the pharmacy for them. So there's a kind of a gap in their medication. So those types of things can happen to, all of our patients regardless, but particularly, in patients with skin of color that are facing even higher economic barriers, even where they're going, to get access to be able to take care of these issues may be different. So we may think about dermatology first, but a lot of patients with skin of color may end up being initially cared for in the emergency room and by our primary care colleagues. So it is such a complex topic that I'm so glad that we're touching on this, because the first step is to really think about, how does this affect our patients outside of the exam room? Really, that's the only way we can start to really peel back the layers and truly, understand, why someone does something or does not do something. And I think the first step is truly, having an understanding of that.
Well, and you touched upon something really important, that sometimes these patients are not sure about how to use their treatments. They don't know if there's refills at the pharmacy. What role do you think culturally competent care plays in some of these treatment-seeking behaviors, initiating therapies, and even being compliant with treatment?
And I think cultural sensitivity plays a huge role. Even our listeners who have decided to listen to this podcast episode today, seeing this title and saying, "Hey, this is something I want to listen to." Hey, you have made your first step with cultural sensitivity. You want to learn more about maybe some of your patients who don't share the same economic background, the same skin tone, the same hair texture. So that is an example of cultural sensitivity. You want to learn more. And by learning more about our patients and sharing some of those things that we have learned, or even being able to ask about their preferences that maybe another doctor's never asked before, their preferences for treatments, their preferences for vehicles, their, ability to get back and forth to the office, all of these things, they are going to feel seen and heard. And some of this advice, really crosses the spectrum, and can be applied to all of your patients. But as we know, some patients may need a little more support And particularly, when there are differences in culture that are involved that may play a role in that patient's relationship with the physician, relationship with the healthcare setting in general. Sometimes we do have to do a little bit more. And I think just by doing those small things, those are examples of having some cultural sensitivities, and that it can make the patient feel more comfortable to ask questions, to even return for a visit, because you've taken the time to ask questions. You've taken the time to listen to what they say, and you've taken the time to actually factor in all those things, that could be going on outside of the exam room that can affect your patient's ability to consistently, have their treatments available.
Well, I couldn't agree with you more. Really making that exam room an area where a patient feels they're not judged. It's a judgment-free zone where they can speak freely, talk about their concerns and complaints, and really feel like the person on the other side is listening to them, I think goes a long way in terms of them complying with any treatment regimen. I know I've heard you on the podium speak about some specific nuances when people have scalp psoriasis who have skin of color, or some mechanical exfoliation practices. Can you tell us a little bit about that and how that can potentially impact the therapy selection as well as response to treatment?
Or, I think when it comes to patients who have more tightly coiled hair, often it can cause even the most distinguished, dermatologist or clinician to pause a little bit. And it is because there are cultural nuances when it comes to, hair. Hair is way more than just hair for everyone, right? But in those with tightly coiled hair, it is a marker of it can be a social thing. It can have many, many different types of expressions. And so there are other elements going on when it comes to, talking about a scalp condition in someone who has tightly coiled hair. Of course, we want to encourage people to examine the scalp of those who have tightly coiled hair, because we know that that's one of the things that people say, does not happen frequently when they finally get to see a dermatologist. So we do want to do that. And we want to make sure that, patients are being treated as aggressively as possible to clear their concerns. It's great to have these discussions with patients, to really have this shared decision making. And we do want to offer the treatments that patients will actually use. If a medication comes in different forms of vehicles, whether it's a liquid, a foam, a cream, we want, even if you may not use that vehicle on yourself, you want to offer that to your patients. And then also offering and discussing systemic treatments as well. Often, the research shows time and time again that patients with skin of color are underprescribed biologic medications in dermatology. So, we have like so many hits right there. So it's like, okay, well, if a patient has a lot of scalp psoriasis that's really affecting their quality of life, for an example, and we don't even examine the scalp fully to even see the scalp psoriasis, and then we don't even, so it's like one thing after another that builds. So it's important to really have those discussions, with patients about the available treatment options, even if you may not think that, oh, this is something they probably wouldn't agree to. It is important to bring it up.
And it's interesting you mentioned about just making sure we offer them a variety of formulations. I remember one of my patients with scalp psoriasis who had tightly coiled afro-textured hair. And as soon as I walked through the door, no hello, she's like, "You're not going to give me another shampoo I have to use every single day, right?" So you can tell she's traumatized by the experience she's had and the limited number of vehicles that she's been offered in the past. So I really think you hit the nail on the head there. And it's so important to keep that cultural piece in mind, because we got to give them treatment options that they can actually adhere to. Otherwise, it's going to be very challenging, and then they'll feel misunderstood ultimately. Mm-hmm. But you did touch upon how a lot of these patients, they're less likely to be offered systemic treatment, which is interesting because when you look at the data, many of our patients with skin of color actually present with more severe disease at diagnosis. So what are your thoughts on the utilization of hospital systems, ERs by these patients? And do you agree that they do have more severe disease at diagnosis?
Yeah, so I think that, when patients with skin of color present with more severe disease, we have to really look at all of the elements that may be contributing to that. If they have been seeing going to the emergency room for treatment, if they've been seeing primary care for a while, let's say they are limited by their insurance type to even be able to be referred to a dermatologist. Maybe they can't go to the primary care as frequently due to work schedule. All of those things contribute to this delay in diagnosis. And as those months and years are going by, their condition can be worsening over time. If they are not able to kind of say self-refer themselves to say, oh, I think I have something, I need to see a dermatologist. And it seems very easy for us. But if you have to kind of think about the other person's circumstances and really put yourself in someone else's shoes who's really facing a lot of barriers, to see how many hoops you really have to jump through and how many things you have to dodge in order to be able to, get that appointment scheduled and be able to see someone who accepts your insurance. And so there's so many barriers. And so I can see how someone can have a delayed presentation to a specialist in order to get that treatment done. And so because there is this delay, that also leaves a lot of time for people to lose hope that, we can even help them. So a lot of times I spend, for some of the more severe cases, saying, yes, we do have things that are available, and trying to convince people that, yes, this is something that could potentially help you. Let's talk about the risks. Let's talk about the benefits as well. And sometimes the hopelessness is just hard to hear. And I find that people who've gone untreated the longest and who have the most severe disease, the hope is it's so far down that you almost have to, you have to spend some time saying, I see that this is really bothering you. And I am here to help you. And sometimes it may take more than one visit to really, have that patient begin to increase their trust in that care relationship. So you don't give up. I always like to leave that door open and to let people know that whatever they select, whatever the option they select, we can still have another visit, and they can even call over the phone if they change their mind, or they want to phone in to, to a family member to help with this conversation, any of those things to help them feel more comfortable actually taking the leap and doing some of more advanced treatment options.
Well, and I think the advanced treatment options, given how severe some of these patients are, can be really, really beneficial. But oftentimes, I'm sure you've experienced this, there's that mistrust off the bat for anything oral or anything injectable. How do you generally navigate that besides just seeing them and trying to reassure them?
Yes. And I say, we have to kind of compare it to how much it's affecting your life. So if it is affecting their lives in a way that, it's really making them upset, then it may be worth, taking the quote unquote risk, to have a shot or have an injection. But for those who, are uncomfortable, again, it's about establishing a relationship, giving them something that they will use consistently. And then when they come back to say, oh, I used it, but it's hard to remember, or, oh, I don't like this about it. I said, well, we do have some other options, and, you can talk about it again at that next visit, provide some information, even provide websites they can go to, and they can see stories about other patients who have used the product and things like that. So all of those things help to build trust for patients to be able to really navigate that. But you're right. We do have some patients who just, they are very weary of needles. But once they start, wow, they are saying, well, I don't like, still don't like getting a shot, but I do like the results of having my skin be more clear. And I love it, like when they start to wear shorts and start showing their skin off, different hairstyles now, so it's just great to be able to see that.
Well, I think you hit the nail on the head there. It's life-changing, many of these treatments. It goes beyond what we see in terms of the clearance of the plaque psoriasis, coming in and strutting in your hairdo, or the pictures I get of some of my patients with short sleeves and shorts on at the beach where they never thought they could do that before. That just makes me feel like, all right, I think I'm doing my job right. But you
Yes.
did touch upon having these patients go to websites. And one thing I've found is we have a lack of skin of color representation in public images, various advertising campaigns. Do you think this impacts our patients' treatment-seeking behaviors, or just their even willingness to go on an agent when we send them to one of those websites?
I think so, because if people Google something and they Google symptoms and the hits don't come back as anything that looks like what they have, then that could further delay them from seeking treatment. To say, okay, well, I guess, that's not something that I have. So if they don't see anything that looks like it, again, that is another thing that gets added to the list. And so a lot of patients come in and they say, well, oh, I'm here because, I have an itchy scalp, or, this runs in my family, or this happens when I get stressed out. Oh, it just runs in the family. What can you give me? It's like, well, there are some genetic, predictors, for this condition, but you have way more than just a flaky scalp, or way more than just, an itch here or there, or way more than, something that gets worse with stress. You have a condition called psoriasis, which is a chronic condition. And we kind of go through the whole thing. And, people can be amazed at that. But think about how many, commercials are on TV that talk about psoriasis and all of these things. A lot of patients may even come in asking for, psoriasis medications for conditions that are not even a psoriasis, because they hear it on TV. But that means that if they go to Google and put in psoriasis, and just out of curiosity, and they don't see anything that looks like them, they think, oh, well, that's not me. That's not what I have. So it's just, being able to look online and have educational resources that patients can see themselves in, that actually is very helpful to educate not only our patients, but also our primary care colleagues. That is would be a tremendous help to have more representation there.
And I definitely agree with you, especially if we're talking about some of these newer medications where there is a sense of mistrust. They're not sure if they're ready to go on it. If they see patients with skin of color who are on the medication and they're doing well, they see themselves represented, maybe they feel better about that efficacy and safety story that comes with that particular medication. I know I tried to Google skin of color and psoriasis, and there was one photo on the first page of Google. You had to scroll down quite a bit. So you're right. If those people aren't seeing themselves represented, they may think this is some other disease. They may not even seek out treatment, especially if it runs in families. Because, well, mom had it, grandma had it, it was just dry skin. So it's probably nothing that can be treated.
Right.
Well, thank you so much, Dr. Heath. This was such a rich and engaging conversation. I definitely think it helped me better understand some of the barriers that our patients with skin of color face. And hopefully understanding those barriers and challenges will allow for us to be ready to take care of these patients and help them overcome a lot of these challenges when they come to our office. And thank you all for tuning in to this podcast.
Thank you so much, everyone, for listening.
Stay tuned for our next episode of Psoriasis and Skin of Color Unplugged, titled Gaps in Diagnosis and Dermatologist Training, featuring expert dermatologist Dr. George Hahn.